Hello, everyone. I'm Dr. Shah from the Vale Medical Practice. I'm one of the GPs here, and I'm joined today by Susan Skinner, who's from the National Institute for Health and Care Research. As you know, since April 2026, the Vale Medical Practice has become a research-ready practice. And so we felt it would be a good idea for us to try and explain what this is all about, what this means for you. And so, yeah, without further ado, Susan, would you like to introduce yourself?
Hi there. Yeah, I'm Suze. So I am the lead for a team of research nurses and admin staff that deliver research in GP surgeries and wider care in general, so care homes and things like that. So,
Perfect. Excellent. Right. So without further ado, let's go on to our first question, which is, what does it mean that our practice is now research ready?
So what it means is that your GP surgery, the VAL, has undertaken some basic training requirements in terms of consent, for example, and that you understand the kind of requirements that the National Institute of Health and Research require when you undertake research. So it could be something as simple as, for example, having a room that's available for my staff to attend and support you with a research study. So yeah, so it's just a kind of list of requirements to sort of ensure that research is conducted correctly in GP surgeries.
Perfect. Thank you. How does being a research practice benefit our patients?
So research kind of improves and enhances care because it helps identify the most successful treatments. And it also gives access to new treatments, and it may improve efficiency and help with any sort of regional variations around stuff. So sort of kind of making things a bit more of a level playing field, for example, around certain conditions. So yeah, it does enhance care quite significantly.
Okay. So one of the queries we've had from patients is, will I automatically be included in research because my GP practice is associated with this?
No. So you're not automatically included, you are invited. Obviously, with any study that comes through, there would be an eligibility criteria. The simplest one might be anyone over the age of 18. Well, if you are in that group over the age of 18, then yeah, you might be invited, but it wouldn't, yeah. But if it was a specific condition, it would have to be you would have to find out exactly if that person was eligible for a start. So you're not automatically invited, and you're never enrolled without consent. So you would always have to agree that you wanted to move forward with a study. You wouldn't just be enrolled on something, but you may be invited dependent on whether you had a condition or was eligible, basically.
I think that's quite important because patients obviously have the right to say no,
Yes.
and we completely respect that. And no one should feel coerced or rushed into making a
No.
decision like this. So
So yeah,
it's
participation
helpful.
is always entirely voluntary. Obviously, we really appreciate it, but there is no pressure whatsoever to take part. And in no way does it affect any future care. So if you said no, affect your relationship with your surgery, for example, or with any of your staff or anything. And it is fine to say do one part of the study and then say no, you don't want to go any further. You know, every time, if it was a study that had multiple visits, if you came back a second time, you would be asked if you were still happy to continue. And if you're not, that's fine. No questions asked. We'll thank you for your participation so far, but that is absolutely fine. There's no
Fantastic.
repercussions.
So no pressure, which is important, I think, to
Yeah,
sort of highlight.
100%. Yeah,
Uh,
100%.
and I think that leads me to the next question quite nicely, which is what kind of research studies might patients be asked to participate in?
So generally in GP surgeries, if you kind of think about, what goes on day to day in a surgery, obviously they're not going to do anything over complicated, saying that. So kind of a list from the sort of simplest type of study might be a questionnaire. I kind of gave an example earlier on. Anyone over the age of 18, for example, recently there was a study that sent out a questionnaire asking about loneliness. And this study was looking to provide the wider kind of government organisations, whatever, with a map, like a heat map of where the places are that people are lonely, and it's probably quite surprising. You know, it's not necessarily all the big towns and cities, and it's not necessarily always older people. So that's the kind of simplest. A questionnaire might be just a few questions on, you know, 3 or 4 questions after you've consented. So yeah, that's the simplest. It could be a trial of new medications. These are quite specific. Again, there's only certain sort of surgeries that would undertake that, because you might need to have certain storage facilities like special fridges and freezers, and there's a lot more steps in place. But we do often get studies that look at a medication. Simply, for example, a blood pressure medication study looking at whether that was better if the patient took the medication in the morning or the medication in the evening, and whether their blood pressure remained more stable, one versus the other. Or it could be, for example, a medicine that's already prescribed for COPD, for example, and someone's noticed that those people on that medication for COPD have less cardiovascular events or something like that. So they might look at that medication and apply it to those conditions as well and see if that made a difference. So it's kind of more that kind of thing around medication. There is obviously, because of the nature of GP surgeries and primary care in general, there is a lot more emphasis on long-term conditions, so, and lifestyle. So it might be lots of studies now looking at the impact of lifestyle changes. Lots of studies with apps, studies obviously using things like AI now are very prevalent as well. Recently, we've delivered a study about an app to improve patients with asthma, and whether the patients that use the app had better outcomes than the patients without the app. And I mean, there's also a study out at the moment. I mean, sadly, it's not in our area, but you know, it's quite there's lots of different studies looking at tomatoes, a special tomato that has a very high vitamin D content that's being made into a soup. So those people are going to be given the soup to see if it improves their vitamin D levels. So it kind of, you know, there's a lot of variation. It involves sort of, you know, very low input, one visit, as to some other studies that might require a few more visits and a few more monitoring. So it could just be something online, or it could be a follow-up call, or it could be a visit to your surgery. But more and more things are remote now, like everything in the world. But where possible, it is always nice to see people in face-to-face as well. So
I could certainly agree with that, and I think it's quite important also to highlight that before any survey or any research project is put out to our patients, it's carefully vetted by our clinical
yes,
team here at the practice,
yes,
so that we're comfortable that this is the sort of thing that we think is going to be helpful or useful,
yes, exactly.
and everything has already been scrutinized from an ethical point of view from the NIHR in any
Yeah.
case. And actually, that's probably something I should have asked earlier. Who are you? What is the NIHR? It might
So
be
the
helpful to.
NIHR, yeah, is a government organisation. So we are part of the Department of Health. We are so part of the broader NHS. Us as staff are all NHS employees. So the NIHR is the overarching organisation that looks at research. So it helps with research design, has helps with funding, and then sitting within that is something called the RDN, which is a Research Delivery Network, which is kind of a bit more where I sit. So obviously, once the study is ethically approved and it's got all the correct sort of, you know, insurances and everything around it, and you know, literally everything has to be approved. The wording of a text message has to be approved. You can't just text anyone any old thing. Has to kind of relate to the study and exactly what's being asked of. The patient information sheet, all of that has to be cross-referenced, checked if it's appropriate language, for example. Obviously, my job and my team's job is to actually make that happen. So it's a little bit like, you know, getting something, I don't know, the old IKEA analogy where you get the flat pack furniture and you get the instruction booklet. My job, obviously, is to come to you guys and say, I've got this lovely bookcase and I can help you build it. Here's the instruction book. And we go through it together. Because obviously, if you're doing a study, and I've presented it to you. And again, as a site, you can say no, you can say it doesn't match my population, haven't got time for it, or whatever. If you're doing a study, there's other GP surgeries and other places that are also doing that study. So it has to be replicable wherever. So yeah, that's my team's job, is to kind of make it happen. But yes, we are NHS. We're all employed by NHS. Myself as a team, we're nurses. We're 5 nurses and 1 administrator, and we all have to be hosted by an NHS organisation. So we have to have all that oversight. So we're all hosted by East and North Herts Trust, which is Lister. So all our sort of training and everything. So yes, we're very proud NHS nurses as well. So yeah, there's lots and lots of governance. We have our own R&D department as well. So there's a double layer. So when a study comes to our area and they want us to go out with it, it is gone through our own ethical checks as well. So there's like a sort of double barrier. And then obviously, like you said, you do your own as well, which is what we always invite you to do. So yeah, there's layers of stuff. So
yeah, I think it's very important for certainly from our point of view as a
reassurance.
practice.
Yeah,
Yeah, to feel
exactly.
reassured and also for our patients that, you know, this isn't just sort of coming from nowhere.
Yeah,
And it's something that can be trusted and that you're a trusted NHS organization.
yeah,
So
yeah.
let me move on to my next question then, Suze, which is, so there's a text message that's gone out to patients, inviting them to whatever study it might be. What happens next? How does it what happens downstream of that?
Well, I mean, it would vary on how the study would be set up, but usually at that point it would be an automatic reply. I mean, at no point is there any data shared. I want to make that clear that study teams don't get to know your name and address, for example. You get referred to as a number. So you would be allocated a number, and then you would, if it was just a simple text and a questionnaire to answer and a one-off thing, that would be it. You would be identified by your study number only, no connection to you, and that data is never stored with any kind of personal information. So it's entirely safe. I mean, other studies that may be more involved may create, again, a very secure loop that would let you guys know that a patient has said they want to take part in a study, and then it would be specific for your surgery to contact that patient, or for one of my team with a specific remit. And, you know, we go through these agreements that we have for us to come to your surgery and contact the patient on your behalf. But as I say, it's quite specific. It is all set out and it is clear. But the study team don't get to keep your information apart from a number. You're just known as number whatever, so that you could match up for your follow-up visits, for example. So yeah, it's quite a tight loop. And that is all set out again at the beginning of a study. So they have to approve that. That has to be understood, how people's data is looked after. So yeah.
No, and I think that's very important. Obviously, as GPs, we're very used to handling lots of sensitive information and
GDPR.
data and
Yeah,
things like that.
exactly.
Yeah, with GDPR, and so that's something we definitely take very, very seriously. So yeah,
And
just
so
keep
do we. Yeah, you
yeah.
know, we don't share information about anything really. You know, it's all usually retained within the surgery, or on the, as I say, on the trial. It might be on the trial site where you would put your blood pressure readings, for example. But at that point, you're a number. You're not Mr. or Mrs. whoever.
Yeah.
Or at that point, you're just a number. So.
Perfect, perfect. And actually, another question which I was asked by a patient not so long ago is it safe to take part in research?
Yeah, well, I think obviously studies go strict through ethical and safety approvals. You know, so something, if it was a medicine study, would have to go through the NIHR, for example. And then as I said again, we will look at the study when it comes through, even if it's been ethically approved. Okay, the chances are it would be fine, but we are known to cross-reference. We will ask the questions, you know, where's that, making sure everything matches up. I mean, we have as an area decline studies, because it might be, for example, that the GPs in your area, I don't want to start getting too technical, but don't prescribe that medication, for example. So we can't come to you because you don't prescribe it as a sort of area. So we look at all of that. We drill down. So we issue an assurance document to say that the study that was safe is actually safe in this area as well. So
No, that's good to know. So that's very helpful. Thanks for that. And I suppose the final question I have is, if despite hearing all of this, I just have, for whatever
Yep.
reason, have no interest in sort of being part of this, I don't want
Yep.
to be involved at all, how
Yep.
might I do that?
So obviously, the first thing to mention, if you don't want to be involved in research, which is entirely your right, you don't have to be involved in anything you don't want to be. You can go to your GP surgery and ask them to apply the dissent code to your medical records. So that would mean even if a study was to come in that you would potentially match to, you just wouldn't appear on the records. Nothing about you would show up because that code is in your notes. And hope that doesn't sound too complicated to people,
No,
but
no, no. And
yeah,
on that point. So the way you do that in our practice is by going online and putting in a system connect
yes, yeah,
on our website, and yeah, we'll be able to put a special code in which basically excludes you from all of this information. So
yeah, exactly.
that's how it would basically work. Yeah.
But I guess if you got approached about a study, for example, from an outside source, I mean, I really don't know, but there are guidelines in place as well to say, how many times people can be contacted, for example. So, I mean, by all means, respond if you said want to say no. I mean, I'm not thinking so much of GPs, I'm just thinking of other things. But equally, they couldn't and they shouldn't keep getting in touch with you. And I think if that was the case, obviously that would need to be raised. But I mean, from my point of view and our point of view, anything that comes through um, the NIHR, that is all been sorted. So
Perfect. Excellent. Thank you. Um, I think that's everything that I wanted to ask. And I think that's been very helpful. So thanks for giving us your time today. The only other thing I was going to suggest doing, and I'm going to see if I can make this work technically, is I'm going to share the screen to show where exactly he says. Uh, can you see that?
yeah. Oh, your page. Yeah.
Can you see the homepage? Right. So if you go to our
Yeah.
website, tvmp.co.uk/research, so, or you can just find it on this over here. And basically at the moment, it's just got a very brief introduction
Yeah.
into that. And what we're
Yeah.
looking to
And
do over time is as we
introduce.
have more projects and things that we're releasing, is to put a small sort of summary of that.
Yeah.
So it's also a nice way for patients afterwards to see what happened
Yeah.
with the research project they might have participated in.
Yeah, so I mean, when people do sign up to research, if they signed up to a research study, it should be clear from the get-go about when the results of that study are going to be reported. So if it was a study around, I mean, I can think of many examples. So a study around, I mean, I use things like blood pressures and stuff because they're relatively more straightforward. You'll be told that the study will end on this date and the reports will be on that date. Just to be aware, though, it can be many, many years. An average
Mm.
lifespan of a study is 20 years from the beginning of
Oh gosh.
conception by
Yeah.
somebody very, very clever who's thought of the idea to designing and doing the literature search to see whether that's anything that's, not been explored before. Hey, who wants to run a study that somebody's already got the answer to them actually, actually reporting at the end, it can be 20 years. But that should be clear about when that's going to happen. So, um, and just to say as well, obviously there is be part of research. So for people that want to join up and just be on a list of people that might be contacted about researching certain subjects or certain disease areas, there is that, and I believe you've got that on your screen as well. And my screen's gone, so
Your
hopefully
screen
I'm
has
still
gone.
there. Am
Yeah.
I still there, or have I
You're
frozen?
not. No, I think it's your camera that's
Oh,
stopped working, or
sorry, I'm not disappearing, but you know what
that's
it's like.
okay.
As we lock out, don't we, in case anybody's
Ah, I see. I see. No,
so that
you're
a
certainly
bit
with us.
like system one, it locks out if just so that people can't go on your computer. So I apologize for
That's
that.
that's okay.
I
That's
think
okay.
it lasts about
We're about
20
to.
minutes.
That's okay. We're
I
about to
think I'm
finish anyway. I was just going to say that.
back in the room.
Hello. I was just to
Well,
say thank you for joining us today,
yeah,
and I
sure.
think our reason as a practice was to sign up to this because it fits very much with the ethos of the practice, which is to
Yeah.
be innovative and using technology to really try
Yes.
and push the frontiers. And I think being able to help and contribute with that, along with our patients, I think is a great idea. So
No,
thank you very much. Thank you.
that's fine, 100%. And just to say, yeah, obviously we really appreciate anyone that does take part in research. It's a really valued contribution. That's that whatever you take part in is a contribution to possibly your own health, but obviously not necessarily even just you, other people's health, and long term, it could that really impact somebody else maybe many years down the line. So yeah, we really appreciate anyone that does take part. And obviously, if you want to look at any of the stuff on the NIHR website, there's lots of stories on there about people that have taken part in research. And yeah, everybody's valued, and I'm happy to come over and join any of your groups and chat to people face to face, bring my team over, and just talk to people and try and demystify it as well a little bit. So yeah, so thank you for talking to me. Hopefully,
Mhm.
that's given people a little bit more of an insight into who we are, what we do, and the world of research. So thank you.
Perfect. Thank you very much. Thanks again.
Thank
Bye now.
you. Bye. Are we done?